Okay, so you're going to find that ideal alignment. Heels, knees, sit bones. You're going to get everything nice and aligned. And then you're going to look at the pelvis, and you're going to tilt the pelvis backwards and forwards. And you're going to do that backwards and forwards 3 times. And you're going to find what you think is the middle position between going backwards and forwards. I might want you just to tilt just a hair the other way, like that. Good. Then you're going to think about making the shoulders nice and wide. So more kind of like that. And then back and neck, this guy is way too high, nice and long. So that if anything, you actually look pretty good, but I just want you to feel kind of the direction where we're trying to go. So that's the alignment. Then we're going to do the powerhouse. The powerhouse is a combination of 3 things. Breathing a specific way, contracting a deep abdominal muscle called the transverse abdominis, and then contracting the muscles of the pelvic floor. First, the breath. It's going to be into the nose, out through the mouth, through pursed lips and tongue. It's going to look and sound like this. Shh. Can you show me? Perfect. Okay. Now abdominal muscles. We have 3 layers of abdominal muscles. We have the rectus abdominis, the abdominal obliques, and the one we are concerned with right now, the transverse abdominis, named because it goes transversely across the lower belly, and when that muscle contracts, it draws the lower belly back towards the spine. You take 2 fingers, put them on this pointy hip bone right here, feel the pointy hip bone, and then roll just to the inside. I'm going to feel this side. So now take that breath in, breathe out, draw the lower belly in. Shh, perfect, beautiful. Okay, now muscles of the pelvic floor. Heard of Kegel exercises. Essentially what we're going to do here. So pelvic floor muscle sits here, urethra, vagina, anus, pass through that muscle. When you contract that muscle, it moves up towards your head. 2 cues to help people get to know their pelvic floor muscles are: 1, stopping a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. Second one is holding in a fart. Can you contract your pelvic floor muscles? Okay, let's combine all 3 of those things. So now it's breath in, breathe out, draw the lower belly back, lift the pelvic floor. Awesome. Breath one more time. Shh. Good. Okay, starting recording again. Okay, so now we're going to do a hip fold. So you're going to take a breath in. You found all that nice engagement. You've taken a breath in. You breathed out. You found the alignment and engagement in a quiet way. Do not try and do this without finding this stuff in the quiet way. So 2 breaths in, shh, just engagement. Then, shh, leg, tabletop. Then breath in, shh, leg back down. Okay? Okay. Breath in, draw in, lift up, shh. So the only thing that, and I didn't explain this well enough, is that you want to have the engagement happening before there is motion. So engage a second and then move. So breath. So the same thing again. Breath in, engage, give yourself a second. Now leg comes up at the tabletop. Now you stay there. Breath in again. You draw in, give yourself a second. Shh. Leg comes back down.